My next guest, Congresswoman Angie Craig from Minnesota, has been working to increase patient access and affordability. Her bill, which seeks to drive down healthcare and prescription drug costs for patients, just passed the House this month. Congresswoman, thank you so much for joining us. This has been great to see you. This has been a burning issue for me, which is, we may come up with a vaccine, we may come up with therapies, we may see companies sort of solve this riddle, but there are hundreds of millions of people in this country and also around. We have lots of vulnerable communities, and I just don't know if we've thought through that dimension of it. You're trying to. Tell us about how we're going to deal with vulnerable communities and people that may not have the health care that I just discussed with Secretary Azar.
Well, Steve, thank you so much for having me today. It's quite an honor, and this is something that we need to be thinking through now as we search for a vaccine. How are we going to equitably distribute that vaccine? And we know that this virus has affected, in many of my counties, Black and brown Minnesotans at 6 times the rate of white Minnesotans. And so we need to start thinking about now and putting together an equitable distribution plan for this country. And, I'm glad to follow the Secretary. I certainly have some thoughts about how we view this from the Capitol, but it really doesn't matter how we view this at the Capitol, because at the end of the day, if we don't start working together to stop playing politics with our healthcare in this country, we're not going to make any progress at all. And so many of the issues that the Secretary identified were actually wrapped up in H.R. 1425, which passed the House last week, an increase in tax credits, extending maternal care in Medicaid to 1 year instead of the 60 days, just so many of the inequities that we see in healthcare today.
Let me ask you a question. You're trying to deal, this is just a completely wing it question, but I'm interested in it. You deal, and your constituents, many of them are in vulnerable communities, many of them, Native American, different backgrounds, Somali and others. And as I've been discussing earlier in the audience, this sort of, much of the healthcare system is a stacked deck for the Caucasian community, and there's a lack of trust out there in some communities. You're trying to think about this, and so part of it is getting people covered, part of it is getting trust. What does your experience tell you about creating bridges of trust from those communities so that they feel like they're really included and it's really also about them?
Yeah, it's such a great question. And I held a town hall on Zoom, just like everything else here the last couple of days, on disparities in our healthcare system. And I asked our counties throughout Minnesota, what are we doing to help bridge that trust gap? And in many of our community health centers and community clinics, it's as simple as making sure that we have folks who can speak various languages and communicate effectively. In many cases, it's a matter of helping people understand where they can go to get health care. And, when I step back and I think about my congressional district, this is one of the highest rates of non-elderly with pre-existing conditions in the country. 51% of the non-elderly in my congressional district have a pre-existing condition. So to hear the Secretary talk about, the work of the Affordable Care Act 10 years ago, what people care about is their out-of-pocket costs, their cost of prescription drugs. What I'm trying to do is to drive biosimilars. Before I came to Congress, I had responsibility for healthcare at a major U.S. Fortune 500 company. We were self-insured. We had stop-loss programs similar to the reinsurance programs we should have as part of today's healthcare system. And we also had a real challenge to control the cost of our biologic drugs. And we need to make sure that we have healthy competition with biosimilars. And so that's one of the things that I've really been working on, is how do we think about the exclusivity period that we give brand name drugs in this country? And at the end of the day, Steve, I think we need to step back. We've been having a conversation in this country for a decade about the cost of health insurance. We need to step back and have the conversation about the cost of health care.
One of the things I want to do real quickly for our audience, many of whom may not understand the various dimensions here, and we do have the biosimilars form. I should be transparent for this. I haven't talked to them about this, but I know the biosimilars are a relatively new advancement of multiple molecule, complex molecule treatments that are more pervasive in Europe and more approved in Europe and dealing with than in the United States. I think Scott Gottlieb, when he was director of the FDA, was trying to speed that up, but I mean, it just is very, very uneven. So I wanted to put that out there when we kind of look at new drug development, how we focus a spotlight on cost and what would be done to bring down the cost like that. So could you tell us a little bit more, not on their behalf, but just on the public's behalf, about what the biosimilar dimension of this is?
Well, right now, for certain drugs, biologics, there's a 12-year market exclusivity period, and there are actually carve-outs in the law that will allow for those brand name drug companies to pay off generic providers from essentially bringing healthy competition into the marketplace. And so for me, this isn't about, biosimilars as a category. It's about how do we create healthy competition? What is a reasonable amount of time for a drug maker to enjoy market exclusivity, and how long, which of course means there's absolutely no competition to drive down price. And I worked for a med tech company for 12 years. I was on the leadership team, so it may seem odd to have a former med tech executive say, we've got to take a look at what's driving cost in this country. We've got to take a look at what is reducing competition. I personally supported the ACA, but I also implemented the ACA as part of a Fortune 500 company, and I saw many of the problems with it, and I've worked to try on an objective basis to bring forward policy solutions that are going to allow more people to access health insurance, but also what are those things that are going to drive down the cost of health care in our nation?
We've been talking a lot about not only health of humans, but the sort of health of society, if you will, today. I just recently interviewed Eduardo Padron, the former president emeritus of Miami-Dade College, who's saying they've been under orders from the Florida governor DeSantis to be prepared to reopen in-person classes at Miami-Dade College. It goes through K through 12 as well. We've seen the president say, if you don't open, we may not fund you. Fred Upton, a Republican from Michigan, has said, we got to have PPE. We got to give money. We got to give support to schools. And Fred Upton, is basically saying, like, he's somewhat opposed to where this is. What do you think? Where are you right now in this question of school reopening and how we should be doing it, and whether we should be providing support for those schools that are going to be taking our children back?
Well, you can't have the conversation about education without starting with the conversation about what should the federal strategy be around the health aspect of COVID-19. And so I certainly from the start have believed that we should have had a more robust federal strategy as it relates to testing, as it relates to contact tracing. I am one of the four founding members of the Supply Chain Caucus in the U.S. Congress, which, Steve, I never thought would be a sexy topic to ever in a million years
talk about. It's big now. Supply chain is a hot topic.
It's a hot topic, and it comes down to how did we use the Defense Production Act? And I'm from a swing district. I support the administration when I think they're on the right track publicly, and I believe it's my responsibility to say out loud, we need a federal strategy as it relates to testing, to supply chain, to make sure we have the components for the capacity of testing. We have got to get our testing and our contact tracing capabilities ramped up. In order to, and go back, we needed to do that to effectively reopen the economy. We've shown in many states we have not achieved an effective reopening of the economy, but we've got to go back to the source of the issue. I think you're going to see the same thing as it relates to education in this country. Unless we have a strong testing, PPE, robust PPE supply, which I believe would require more robust use of the Defense Production Act, we're going to be opening, we're going to be shutting down, we're not going to have contact tracing capabilities in our schools. And at the end of the day, this is a health care issue. We can't have the conversation about the economy or education without addressing the health care issue first.
Well, Representative Angie Craig from Minnesota, too, I hope you'll come back and talk about this, because there's a lot you just hit out of the park for the last comment, so I hope we can do this again soon.
Thank you so much for having me.
Thank you.